This is Talk to Kedi, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on yet another edition of your number one educative online broadcast, Talk to Kedi. Our topic of today is respiratory tract infections, also known as RTI. In other words, we'll be talking in depth on what respiratory tract infection is, the types, causes, symptoms, treatment, and also the preventive measures. My name is Felix Adedoyin. Welcome on board and get ready to learn. With me in the studio today is one of our amiable lecturer. He is a network marketer par excellence with multiple feats. He is also a seasoned TCM consultant. Is no other person than our very own Mr. Daniel Akamgba. Mr. Daniel, welcome to the show today.
Thank you very much, sir.
Can you please introduce yourself to the audience at home?
All right. My name is Mr. Akamgba Daniel, a KEDI health consultant, a lecturer in business area, and also a Star 7 consultant in the business.
Wow.
Touching lives and helping a lot of people to come to understand their body system and how to maintain a healthy living.
All right. Okay. You are welcome, Mr. Daniel Akamgba. We are so delighted to have you again. In case you're tuning in for the first time, this is Talk to Kedi, your number one educative online broadcast brought to you by Kedi Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. Welcome on board and stay tuned. In today's broadcast, we'll be discussing a crucial health issue, that is respiratory tract infections. Like I said, it is popularly known as RTI. I'd like to ask us, did you know that respiratory tract infection claim the lives of more than 800,000 people annually? Yeah, I think you don't know. All right. Do you also know that respiratory tract infection can affect people of all gender without no significant predisposition, whether the person is a male or a female? Indeed, respiratory tract infection are not something we should joke about. All right. Don't forget, you can be part of this conversation in the comment section. Please feel free to drop your questions, your comments, in case you have probably treated anyone who had undergone this phase. Feel free to share your opinion, your treatment phase and everything. Feel free to share with us. Let us learn together. Let us rub minds together. We want to hear from you. And in case yours is question, whether the question is related to today's topic or any other topic that we have dealt with in time past, feel free to drop your question, and I can assure you that before the end of this broadcast, we will do justice to them one after the other. You're welcome on to this broadcast one more time. Okay, over to Mr. Daniel Akamgba as he takes us through the topic of today, respiratory tract infections. So, Mr. Daniel, I would like to ask you, what exactly is respiratory tract infections, and what are the types, the common types that we have?
All right. Now, respiratory tract infection is an infection that most likely affects a lot of lives. It affects a lot of lives and it's most common. Now, what is this respiratory tract infection? It's an infection that affects the respiratory system, which help in respiration, which help in through breathing.
Okay.
Now, when we talk about the mouth, the nose, is this respiratory system, the lungs and the airways.
Yes.
That is respiratory system. And this respiratory system infection affect it. And when it's affected, breathing becomes difficult. When it affects, a lot of things goes wrong in the body system.
Yeah.
So respiratory tract infection is something to be dealt with because it affects the respiratory system. And it has two types of we have two types of respiratory infection.
Okay.
One of these respiratory tract infection is upper respiratory tract infection.
Yes.
Very, very challenging when it comes to health. Upper respiratory tract infection affects the upper part of the body,
Okay.
which have to do with the mouth, the nose,
yes,
and the likes of them. So, and when this happens, it affects the throat as well. It affects breathing. Is it somebody breathing abnormally? And sore throat occurs when this upper respiratory tract infection takes place. It causes sore throat.
Sore throat.
Yes. You see some people, even to drink water becomes a difficult thing, let alone taking solid food. So it affects it. And one of the things that causes upper respiratory tract infection is common cold. And that one is rampant today. And this happens mostly during winter.
Yes.
It happens mostly during winter.
Okay.
So one needs to be careful and one needs to really pay attention to the body system. Now, the second one is the lower respiratory tract infections.
Yes.
These lower respiratory tract infections affect the lungs, the airways, and it can really be dangerous.
Okay.
It is very serious and it lasts longer than upper respiratory tract infection. It lasts longer.
Okay.
So one needs to pay attention to this. And one of the things that triggers is bronchitis and also bronchiolitis. Yes. This bronchitis is most especially affects the adults. Okay. It affects the adult. That's why we advise people to avoid smoking. When one smokes constantly, things like this are bound to happen. So it is very, very important that one watches himself or herself carefully. Then the bronchiolitis affects the children. It affects the children. It can cause cough, it can cause so many problems in the body system. It can cause difficulty in respiration. Okay. So it is very difficult to handle it. Okay. But at the same time, it can be taken care of. Okay. Now, pneumonia is also part of this lower respiratory tract infection. So we need to properly take care of ourselves and also our children. Because these things is respecter of nobody. It's respecter of whether male or female, it doesn't
no
care.
Gender.
No gender. Okay. It affects everybody. So we need to really be careful of what happens in our body system and the things that goes into the body system. Many people expose themselves to toxins, and toxins can affect respiratory tract infection. It can really cause respiratory tract infection. So abnormally. Okay.
All right. We've edited. So with this now, having known the types that we have and the definition of respiratory tract infections, what are the common causes of RTIs? And what are the symptoms that we should look out for? For anyone who, probably for those who wants to know, what are the common causes? You know, you've cited to us all these types and a little bit of the examples of it. So what are the common causes and the symptoms that follows it as well?
Now, the common cause of respiratory tract infection is bacterial infection. Bacterial infection. Okay. Yes. Bacterial respiratory tract infection is that affect the organs. And though this one does not stay too long, within 1 week or thereabout, it has already, it goes on its own.
Yeah, okay.
Bacteria, it goes on its own. And that one is and this bacteria comes in a single-celled organism. It is being caused by that single-celled organism. Yes. But then, viral respiratory tract infection, that one is more dangerous. Okay. It's more dangerous. It affects the airways. And it is the airways that help in carrying out air.
Yeah, throughout the body system.
Exactly. But once that is blocked or inflamed, it becomes a problem. Breathing becomes a problem. So these two things really affect the body system. And that's what causes respiratory tract infection. Okay. Smoking also causes it. There's some people they indulge in smoking constantly. And some people sit close to someone that is smoking. Please,
because I want to talk about secondary smokers.
Yeah.
What should we talk about those?
Some people say, I don't smoke, but they sit beside somebody that smokes.
Smoking.
And that person smoking, the person sitting beside the person will be taking more than the person even smoking. As he brings it out, the person stays close, inhales it. And once he inhales it, begins to act in the body unknown to that person.
Okay.
So it is important we understand how we channel and move and who we associate with.
Okay.
Because the more we take it in, the more it stores in the body system. That is why it is important to detoxify the body system, because a lot goes into the body from time to time.
Yes.
So we really need to work on our body system and pay attention to our body system. And once we notice things like this, we should understand that something is going wrong in the body system. What are those things?
Okay, that's taking us to the symptoms, right?
The symptoms now.
All right, okay.
The symptoms. When you notice, you are there, please, anytime you notice things like this, act. One is constant sneezing. Okay. Every time sneezing, it's all around. There's a problem. A lot of things has been introduced into the body system, and it's really affecting. So
it's like blocking the airway, so the person is sneezing out.
Sneezing.
Okay.
The person will just want to clear it off.
Yes.
So that's one. Sore throat is another sign. And sore throat, like I said before, if one has sore throat, it will be difficult to swallow things.
Yes.
Even to drink water will be a problem.
It's so difficult.
Let alone taking solid things. So sore throat is one of it. Headache, constant headache becomes a problem.
Yes.
Somebody will be having constant headache. That is a sign of.
Is it headache at a part of the head or the entire head? Now sometimes we have something we call it migraine.
Yes.
So is also part of these symptoms?
Now, this headache I'm talking about comes as a result of what has been introduced into the body system. Okay. It can come even the forehead, but every part of your brain. You understand? You can feel it. Okay. When we talk about migraine headache, it just exactly.
What about the one that you feel at the back of your head?
Many things can cause headache. Accumulation of cholesterol can cause headache.
Okay.
Yes.
Okay.
High increase in blood pressure can cause headache. But when you are talking about this respiratory tract infection headache, in fact, you'd be stressed. Your brain, every part of it will be stressed. Even your facial expression will show that something is wrong with this person. You understand? The eyes and the likes of them. Okay. So that is the headache I'm talking about. Okay. Many things can cause infection, and this is one of it. Now, another thing another symptom is running of nose. Okay. Running of nose is another symptom. So when you see all these symptoms, fatigue and things like that, one need to watch out. Okay. Coughing, constant coughing. Also, what is a sign of respiratory tract infection? Okay. So when we see things like this, we need to act. Though after a week or two, it can easily clear off. But if it does not, one need to take action.
Okay. Yes. Okay, I like to come in this angle. You're talking from the angle of the secondary smokers and co. We only talk about smoking. How about people like us that we move from point A to point B, and you get exposed to carbon monoxide coming from the vehicle? Or probably you see someone cooking. Take for instance, people in the village that they cook with firewood and coal. Could that also affect their respiratory? Could that also be a cause to respiratory tract infections?
Yes.
Okay.
It causes it as well. Because those things are toxins that the body system does not welcome. Okay. So when imagine you are sitting in a bus, trailer just passes by. As it pops it up,
smoke, look at all those starter buses and you just blast so many smoke to you.
And once you inhale it, my brother, it detoxes the body system. Yeah. It affects the respiratory system. It affects the body organs. So that is why detoxification is very, very important. And it is important we pay attention to those things. We don't just neglect it. It's normal thing. We are in Lagos. Those things are bound to happen. Exactly. We just take it. No.
Okay.
You should take up. That's why we advise people to eat the right meal.
Okay.
Take the right thing. Take fruits and vegetables because it helps to neutralize those things,
Yes.
those
Okay.
toxins. Very, very
Okay.
important.
Okay.
Because if you are the type of person that the only time you take fruit is when you are looking for change.
To pay back, man, to pay.
Of course.
Yeah.
It will be a problem.
Yes.
Because when those things start storing in the body system, nothing to use to flush it out of the body.
Yeah.
Exactly. So that's why fruits and vegetables are very, very important. You don't need to wait until you start rushing to hospital or doing one thing or the other for our body to be okay. No, we need to take proper care of ourselves naturally.
Okay. So, okay, how about another angle now? How about someone that stays under the fan? You understand? Or is and starts sneezing? Should I say that, or could we say that the person is also suffering from respiratory tract infection at that? And some of us will just stay under the fan for quite a while. When you wake up, you start sneezing continuously like that. And you told me that sneezing or running a flu is part of respiratory tract infection. So are you saying now that this person, if any individual is in this category, the person is also a patient with respiratory tract infection?
Initially, I said that common cold is one of the things that is responsible for this respiratory tract infection. Common cold, and it's happening every day.
Okay.
Is this AC is one of the cause. Because
AC in the motor, AC in the car, in the house, in the restroom, AC everywhere.
So the organs will be choked, will be affected. So that's why we need to pay attention.
Okay.
Even in the car, regulate it.
Some people they can't do without it.
Exactly. So it's not advisable. It's not advisable. You are in your office.
Yes, so
you are in AC. In your car,
you are in AC. In the bedroom, AC. In the kitchen, AC. Everywhere. Please tell them.
It is very important. And some people consume a lot of cool things.
I have somebody very, very close to me. The person cannot do without good things. And if you serve the person ordinary water or ordinary drinks, they say no. Until the thing is chilled, the person will make me to understand that okay, it is clearly written on all these items, best served chilled. So what should we do in such a situation?
My brother, my sister, it is important you abstain from things like that. Take water at room temperature. It will really help your organs. If you keep on indulging in things that are cold, it will be affecting the organ, the lungs especially. The airways will be affected. Okay. And that is one of the things that causes flames, inflammation.
Exactly.
And when it inflames, mucus begin to develop. And once that continues, breathing becomes a problem. So it is important to abstain from chilled things.
So should we tailor it to gender-wise now? Is it men alone or women or the two parties?
It's for everybody. Okay. Young, old, male and female. Everybody must abstain from cold things. Right. Because it affects the organ. It affects the respiratory system.
Yes.
Some people go as long as chewing block. Ice block.
Yes.
Ice block. You give them water. You give them some of them. They want to buy Pepsi. Give me the one that is block.
I have a friend like that too.
And they will be taking it.
It was the extra block.
And they are taking it. They say, as I'm taking it, you will dissolve it.
Exactly.
No.
Some people say the joint is far.
The joint, so they will be drinking it. No. It's very wrong. It is very, very wrong.
Okay.
Some will take ordinary ice block, water. They will take and they will be chewing it. As they are chewing it, it will be affecting the organ.
My viewers, please, desist from taking cold things. It affects your respiratory tract. Thank you. All right, sir. Moving on. I would like us to also tell our viewers too, how can an individual differentiate between bacteria and viral respiratory tract infection? You once talk about these two types. Looks like these two types are the most common. So how can someone differentiate between bacteria and the viral respiratory tract infection? And also, then how can this be prevented? How can we prevent the occurrence of this respiratory tract infection, especially in the groups that are very, very predominant? This is predominant to happen to them. How can we prevent it, and how can we also differentiate between bacteria and viral RTIs?
Now, like I said before, bacterial respiratory tract infection is usually caused by a single-celled microorganism.
Yeah.
And why the bacteria, the
The
viral
virus.
part of it is being caused by viruses.
Okay.
And it is very small, smaller, very, very small. And the largest of it is smaller than the smallest of bacteria.
Exactly.
So these two are quite different. Viral infection is caused by viruses. And apart from that, the bacterial respiratory tract infection can be identified by color as well.
Okay.
The bacterial aspect can be greenish in color, the mucus. You see the
That's
greenish
what I want
part
us to
of
talk
it.
about. Like precisely. Let's say if I'm coughing, should I say this is bacterial infection? You understand? Or if I start sneezing, it's a viral that causes. So that's what I want us to differentiate so that we can all understand and learn this.
All right. The color can be greenish in color, that of bacteria,
Okay.
or yellowish in color. When you see that, when you see that, you need to use that to identify it. It identifies that this is a bacterial infection.
When you cough, right?
Cough out
and the
white,
mucus comes out.
yellowish mucus.
Okay.
Is a sign that is a bacterial infection.
Okay.
But that of viral infection,
yes,
you can also use color to identify that. When you see whitish color or clear mucus, that one will tell you that this is a viral infection. And viral infection does not live out of the living organism.
The bacterial one.
The viral
one.
Yes.
All right. Okay.
The viral infection doesn't live out of the host.
Okay.
It lives in a living host.
Okay.
And that helps it to multiply. To multiply. But once it's out of the host, it dies. So that's the difference between these two. Okay. One, you can use color to identify it.
Yes.
Two, they are being caused by different things.
Okay. Can we use symptoms to still differentiate them? Probably this is the symptoms for the bacterial RTIs, and this is the symptoms for the viral RTIs.
Yeah, pneumonia is one of it.
So
when it comes to the bacterial viral aspect of it,
okay.
Pneumonia is part of it.
Okay.
Bronchitis is also part of it. Are you getting it?
That's on the viral part.
On the viral part.
Okay.
So when we talk about the sore throat and the likes of them, the sneezing, those ones are for the
like catarrh,
the runny nose and the likes of them. You understand? So when we see things like they don't go using antibiotics in treating it, it is just like more complicating matters.
Yes, sir.
Because you cannot treat such thing with with antibiotics when it comes to the viral aspect. Yes. So that's why we need to pay attention to how we attack things like this. Very, very important.
Okay, sir. All right. So how can it be prevented among people with high risk, the groups of people with high risk of contacting RTIs? How can they prevent it from occurring?
To prevent it, one, we need to try as much as possible to be washing our hands regularly.
Okay.
We need to wash our hands regularly.
Yes,
that's one way of preventing it. Yes, especially when we find ourselves in a public place. Once we're out of that, we need to wash our hands with soap. Or if we don't have soap at that point in time, we can use sanitizer to clean our hands. Very, very important. Okay. And also, we need to always use our arm to sneeze. Okay. Whenever we want to sneeze, we should use the shirt of our arms to cover the nose. Okay. We sneeze it this way, it will really help. One, it will help in spreading it to other people. Yes. It will help us to
So we
prevent
want to
spreading it.
to prevent spreading it.
Spreading it
Okay,
to
okay,
others.
okay.
It will really help us to
Okay.
prevent spreading it to others. And it will also help us
Mm.
not to what?
Inhale it back
inhale
again. Okay.
And when you do it that way,
Mm.
look at this. Imagine people are seated near you.
Yes.
You do this, you sneeze with your arm.
Mm.
You have prevented this person from contracting such.
Okay.
If you use your palm as well, my brother, you are causing more problem than more harm.
If I use handkerchief,
if you use handkerchief or tissue, is good.
Okay.
But don't use your palm
Directly on my palm.
Yes.
Okay.
So some people mistakenly, because of how it comes out, they might not have the handkerchief.
Exactly. Even before you're able to take it out, it don't come out. I want it done.
One, after that, ensure you wash your hands.
Okay.
In order to avoid spreading it to other people. Because when you don't wash your hand and you shake someone, it will transfer to that person.
Okay.
Yes.
Okay.
It will really transfer. And try not to be using ordinary palm. Use tissue and handkerchief. Why? You don't know the person you might have shaken. When you want to sneeze and you use your hand direct to your nose, you can introduce the germs to your body system. Yes. So that's why it's important to always have handkerchief or tissues with you.
Okay. Okay.
Very, very important.
Okay. All right. Okay. So with this now, when should anyone who is a patient living with RTI seek for medical attention? When should someone seek for medical attention? And are there any lifestyle changes that such a fellow should watch out for?
Okay. Now, when you notice this kind of signs coming up,
yes,
it is important to make a wide assumption. It is important to take action.
Yes, sir.
And what are those signs? Loss of consciousness. When you are experiencing consciousness and you are losing consciousness, it is important to run for help. Run to a health provider to assist in that regard.
Okay.
Loss of consciousness. 2, when you notice high fever, fever more than 103 degrees Fahrenheit, it is important to run for help. Imagine somebody's...
How do I know that my temperature is about 120 degrees Fahrenheit I just talked about? And I don't have thermometer with me, I don't have all the stuff with me. How can I...
If you don't have that,
like I am now,
right.
how can I determine that?
If you don't have that, one thing that you need to check out for is your body temperature. You know your body temperature at normal temperature. When you are not sick, when nothing is wrong with you. Well, at a point, there are some people that if you go closely, as you touch them, you see as if they just brought out the person from fire.
Yes.
Very hot. If you notice that in your body, my brother, you need to take action. You don't need to wait for any prophecy.
Okay.
You don't need to wait for any No,
yes.
You need to take action.
Okay.
Body temperature will tell you that.
All right.
Yes. No. Another thing that you can use to run to a doctor, and when you see it, you run to a doctor for help, is when you see yourself vomiting blood.
Because I want to sometimes... Okay, what about if you just cough and blood comes out of it? When
you see yourself coughing out blood, it is important to run for help. Call or run to a health provider to help you out. Because at that point in time, it is no longer just wishing.
Please, let's seek for medical attention. Please.
It is not just thinking, should I? Yes. No, you need to what? Act. Look for a help. Go to health practitioner or a health provider for an assistance.
Okay.
That's the only way at this point. You don't need to wait.
So are there any lifestyle changes that can help minimize the occurrence or the reoccurrence of RTIs?
Smoking, I'll go back to that. It's another thing to work on.
Okay.
Avoid it completely. That's why they say smokers are liable to die young.
But they take harm. Despite that it is written clearly on it.
So it needs to be changed. Such lifestyle needs to be changed. Another thing is constant intake of cold alcohol. Some people cannot do without alcohol.
Oh.
Different types of alcohol.
Some
people can take alcohol. Some people can take alcohol as if there's no tomorrow.
It tastes like minerals.
Honestly, it is very, very important to work on.
Okay, sir.
That is one of the lifestyle to change. And associating with toxins, with people that spread toxins like chemicals.
Okay, we should dissociate ourselves from
Yes.
them. Okay.
When you notice such, move away from them.
Okay.
Don't wait.
Okay, how about someone like that secondary smoker now? Someone in a moving vehicle and smoke suddenly comes. Should I run away from the vehicle?
The person needs to constantly take in water and do detoxification.
Okay.
That will help.
Okay.
And the person also needs to be taking fruit and vegetables.
All right. Okay. Fruits and vegetables. All right. So, sir, what are the effective methods of managing RTIs, and how does management of RTI differs between children and adults? We've said fine, it affects everybody. But how can you treat it? How can we manage it? What are the effective methods of managing RTIs?
Constant intake of water.
Okay.
Is very important.
Okay.
You need to take water regularly.
Room temperature water.
Room temperature water.
Okay.
We also, from time to time, more especially morning and evening period, take warm water.
Okay.
Very, very important. It helps the body system. Okay. And it also helps in clearing the mucus. Okay. Now, for the adults.
Okay, this is for the children.
Yes.
Taking water
regularly
in the morning.
Water also
yes.
Help. Then the children, the mother or the parents should encourage the children to eat from time to time, at least little, because some children at that point in time they might not want to eat anything. Okay. But they need to encourage them to eat something. Okay. But not forcing them to overload.
Okay.
To take heavy food.
Yes, sir.
It will not help them. Okay. It will weaken the system. It will make them to be dormant. As in, they will be weak. Okay. They cannot be able to express themselves. Yes. So, but little by little, they'll be gaining energy. Yes. Also, for the adults, adults can take warm water also morning and evening. Okay. They should avoid cold things. And also, adults can be taking lemon, hot lemon and honey drink. Okay. It will really help in soothing the mucus to clear off. Hot lemon? Yes, hot lemon and honey. Okay. Mixing it together, taking it to really help soothe the tract for the mucus to be able to clear off. It also helps for the cough. Okay. But children must not try it. Children must not take honey and lime. Yes. And lemon rather. Yes, especially worst children below 1 year or and above. 1 year. Okay. Precisely. Okay. So they should not take such. Okay. That is one thing that will really help in managing this. All right. And also, adults should try as much as possible to be bathing, even the children, warm water morning. Every morning, warm water. Okay, sir. It's really helpful. Okay. It's really helpful. Avoid giving to bathe. Cold water. Cold water. That is bathing them ordinary water. Let me use that one. Okay, for them to not fridge water. No. Not freezed water. Ordinary water at room temperature. Yes. I understand. So because constant bathing with ordinary water will affect, especially this kind of period we are now, rainy season. Yes. So there's so much cold. Well, I know some people are TCM consultant. I believe you might have treated somebody or many persons with RTIs. So can you please tell us what KEDI products have you used in treating RTIs and how effective are they? What's your success rate? And also please tell us the dosage for these KEDI products that you used while treating patients with RTI. All right. Having seen what is happening today, yes, I always try to reach out to as many people as possible to help them out.
Okay.
Because health is wealth.
Yeah.
So I've come in contact with a lot of people with this kind of health challenge.
Okay.
Like I met a man, even the way he talks, he tell you that something is wrong. To speak out is a problem. So you say the man is talking from nose. So, and the way he sneezes, always with handkerchief, he keep on managing himself. I had to approach him and say, sir, I greeted him and I explained myself to him. I'm a health consultant and I've seen how you feel and what has been happening to you. How long has it been like this? He says it's over 1 week now. This kind of thing that I started.
Yes.
I now told him that if you see what you can do that can help you alleviate this, will you appreciate it? He said yes. And I told him, okay, that I'm a health consultant and I will get you in touch with you and I will recommend some product that you're going to do. But I need to run a comprehensive body checkup.
Exactly, to know, at least to know what
is happening.
do. Exactly.
He said, no problem. So he invited me to this. I went to run tests on him and I discovered some issues and the lungs, how the vital capacity of prayer and things like that. So I had to recommend some product. And when I want to treat, I don't just go ahead and recommend it before the person use.
Yes.
Because like I said before, a lot will absorb a lot of things in the body system. You are first and foremost, I detoxify the person. So I recommended product that you can use for detoxification, which he bought the product. I recommended Reishi, colon cleanser, and Shinghao. Also gastric fort. I recommended those products to him and he started using the product. Reishi, I recommended 3 in the morning, 3 at night. 1 hour before food.
For the Reishi?
For the Reishi. 1 hour before food.
Both morning and night?
Both morning and night.
All right.
Morning and night. 3 morning, 3 night. All 1 hour before food. Then I recommended colon cleanser only at night. 30 minutes to 45 minutes after food. You should take it before going to bed. And you should eat on time so I will not go to bed late. So I recommended that to him and also recommended Shinghao to him 2 morning, 2 nights before food. Like 20 minutes before food, 2 morning, 2 nights. And also gastric fort, 2 morning, 2 night after food. Like 15 minutes after food, you take it. So he used it, I can only tell you, before he even finish up the product,
this detoxification
product, he called me. Because I told him that there's another one that you need to use.
After this process.
After this one. When he called me, he started telling me how he felt. Started telling me, giving me his experience while using the product, how the product has been working and all that. I'm so excited that I love it. That will listen, you need to use those second one.
The second
stage I want to recommend. Does this thing need to use it? I said, yes, I need to complete it. Because to him, they feel that all is well. That he has gotten the result. No need of using the second stage again. I really encourage him to use the second stage in order to perfect it. So, and the second stage, I recommended cardiactive to be continued with the Reishi because it was a big Reishi, big cup of Reishi. So I recommended cardiactive and golden haifa. Yes. Why I recommended golden haifa is because of low immune system. Immune system is one of the things that is what helps us to fight against sickness and infection.
And once your immune is low, you are prone to different kinds of disease,
health challenges. So the low immune system needs to be upgraded. So I recommended golden haifa to boost the immune system because golden haifa boosts the immune system very well. So that was why I recommended the product for him to boost his immune system because it's a defensive mechanism that fights against infection. So, and also the cardiactive gives him energy and vitality. It helps him to be active and it also helps in clearing the airways. So that was why I recommended the cardiactive to the man to continue. And when he used this product, my brother, he said he has been using different kind of synthetic drugs, different chemicals and all that, no result.
But he tried this
until
Our
you
amazing
use
products. Okay.
And now ask me, where is your company?
I
told him, our company is at Oriri, Igomuru,
Exactly.
and all that. So I explained to him, that was how he continued the product. Today, the man has registered in my business.
Wow.
Because after giving them the product, I don't want them to just continue buying and
Sure.
produce the business to them.
Exactly. So they can also benefit from
the
what
business.
Kedi offers.
Exactly.
Okay, if I may ask, like for how many months was he on the first dosage, the first treatment packages?
For the detoxification.
Detoxification package. I mean, like, for like how many months would you or anybody stay on that?
This one is not even months.
Okay.
I gave him the product within 1 week or two. I think 2 weeks.
Okay.
That he started the colon cleanser, sugar, and the Reishi. 3 has already finished.
Exactly.
3 has finished. Colon, what's it called? Gastric fort. As also because I gave him small gastric fort. But colon cleanser and Reishi,
that's still there.
When he called me that he has seen a big difference in your body system. 2 weeks. 2 weeks.
Wow.
Then I introduced the remaining one to continue, and to the glory of God himself.
Wow. All right, we have heard it up from Mr. Daniel Akamgba. Now let me pause and take our question. I have here with me a question from Tayo Adeonipekun on our Instagram page. She says, how do we detoxify our respiratory system? I think we have talked about it earlier, but for the sake of emphasis, you can just please relate again. How do we detoxify our respiratory system? That's the question.
No. To detoxify, like I said earlier, a lot of toxins goes into the body system, dust, smoke, and the likes of them. To detoxify naturally, you need to engage yourself with constant, adequate intake of water.
Okay.
Warm water, morning and evening, and during the day, at least 3 liters of water.
Okay.
Very, very important. It helps in flushing out the system, the toxin in the body system. Very, very important. And also eating fruit and vegetables constantly will also help the body system to detoxify all those toxins in the body system and boost in the immune system. It also helps the vitamin C to be upgraded, which will help in fighting any organism.
All right. Yes, thank you. If you're just joining us, you are still tuned to Talk to Kedi, and our guest, Mr. Daniel Akamgba, has just thoroughly discussed all about respiratory tract infection. Thank you so much for tuning in. Because of our time now, I will not be able to take other questions coming in. But however, I leave us with our Dr. Cap Active for today. It says, a healthy immune system is your best defense against respiratory infection. So, eat well, sleep well, stay protected, and don't forget to boost your immune system with KD Immune Boosting products. I take it again. A healthy immune system is your best defense against respiratory infection. So, eat well, sleep well, stay protected, and don't forget to boost your immune system with KD Immune System Boosting products. So on this note, we call it a day on this edition of Talk to Kedi. I hope you have learned something valuable in today's broadcast. I hope you have learned a lot of things. In today, we have learned valuable things about the types, the causes, the symptoms, prevention, and treatment of RTI. A special thanks to our wonderful guest, Mr. Daniel Akamgba, who has taken time to share his expertise with us. Please, I would like you to give us your last note as we take the wrap for today's edition.
Thank you very much. Our guests out there, please, I beg you, in the name of God, take proper care of your health, because health is our greatest wealth. And with good health, there is hope for the future.
Yes.
So take proper care of yourself. Always detoxify your system. Always boost your immune system. And KD is here for you with wonderful products that will help your body system to function optimally.
Yes.
The health is in your hands. Handle it effectively. KD products are here for you to clear up your body system, to take care of your body system, any form of health challenges, KEDI product is adequate. KEDI product is ready to help you out in this regard. KEDI is number one.
Yes, you've
Pure
heard it
herbal
all.
products.
Yes,
That's also
KEDI
one.
is number one. We have the best immune boosting product ever. So, in case you joined this broadcast late, don't worry. The full video of this edition will be on our Facebook page at KEDI Healthcare Industries, on our Instagram handle at KEDI Healthcare _official. It's also be on our YouTube channel at KEDI Healthcare, and also on our mobile application at that's KEDI Care app. Feel free to watch and share with your loved ones. And don't forget to join us on the next edition of Talk to Kedi, because it promises to be insightful. Thank you so much for tuning in. Till I come your way next time. Bye for now.